Walk in, perform hand hygiene, introduce yourself. Hi, I'm Chris. I'm going to be your nurse today. I'm going to perform a head-to-toe physical assessment on you today. Patient appears to be a well-developed, well-nourished, 26-year-old male. Doesn't seem to be in any acute distress. Could I have you tell me your name?
Eric Michelson.
Your birthday?
5/30/94.
Do you know what year it is?
2020.
Who the president is?
Trump.
Do you know where we are right now?
Detroit.
Do you know why we're here?
For an exam head to toe.
Okay, this patient is alert and oriented ×4. They're speaking good, clearly and concisely, so their speech is good. Okay, I'm gonna touch your face, just need you to push against my hand. Okay, that's it. Then push down. Okay, push forward. Back. Okay, shrug your shoulders. Good. Take my fingers, squeeze them. Good. Okay, now I need you to pull. Okay, and then push. Good. Now with your feet, just bring those out. You push against my hands. Okay, and pull. Good. And you push down like a gas pedal. Okay, so patient muscle strength is 5 out of 5 and is symmetrical and bilaterally in upper and lower extremities. Okay, so now we're gonna take this and this. So I'm gonna poke different areas of your arms or your legs with cotton, and that's gonna be soft, and these scissors, and that's gonna be sharp, okay? So you just close your eyes, and then tell me where and like whether it was the sharp or the soft, okay?
On my right forearm, it was sharp.
Okay.
On my left upper arm, it was sharp. On my left forearm, it was soft. On my right calf, it was hard. On my left calf, it was soft. On my right thigh, it was soft. On my right shoulder, it was soft. On my left thigh, it was sharp.
Okay. So the patient's sensation is symmetrical and intact bilateral in the upper and lower extremities. Okay, so I'm going to inspect your head, look at it. Looks good. Palpate. Deformities noted. Okay, check your eyes. Have you look straight forward at me. Good. Same thing, just keep looking forward. Good. And then just follow this pen light as I move it closer to your face. Good. Patient is Perla is present. Check out your nose. No nasal flaring noted. And could you open up your mouth for me? Okay. No circumoral cyanosis. Mucous membranes are pink, well nourished, moist, and there's no pursed lip breathing noted. Okay, just keep still looking forward, checking out your neck. No accessory muscles used, no JVD noted. Okay, so I see no accessory muscle use and no jugular vein distension. Palpate, right in, one side at a time. Okay. No thrills felt. So take. So forward. Using the bell of the stethoscope. No bruits, no carotid bruits oscillated at this time. Okay, we're going to assess the patient's chest, inspect it, submit for any deformities, scoliosis. That looks good. No barrel chest noted. Okay, so I inspect the contour and shape of the chest wall and evaluate patient's breathing efforts. You're breathing good, normal, so see no visible abnormalities in shape, no barrel chest, no signs of scoliosis. No visual shortness of breath or intercostal retractions, and the patient is not tripoding. Okay, so now we're gonna auscultate your lung fields. Just read normally for me. Okay. Okay, no lung vibrations, either posterior or anteriorly. So we're gonna listen. Just breathe in and out for me. Lift your arm up for me. Okay, lungs are clear bilaterally, anterior and posteriorly. No wheezes, crackles, bronchi, or any abnormalities heard. Okay, now I'm going to inspect your anterior chest wall. Okay, no heaves noticed over your anterior chest wall. Now we're going to palpate the anterior chest wall, go mid-clavicular to intercostal space. Okay. Some. We're in the pulmonic. We'll go to the herbs. That one. The nipple. No rubs or abnormal vibrations or thrills felt. So now we're going to listen to those areas. Same thing. The clavicular. I hear normal S1 and S2 harp sounds, regular rate is rhythm, no murmurs, gallops noted, rubs noted. Okay, I'm gonna see your fingers, inspect capillary refill. Fingers. Okay, normal capillary refill, less than 2 seconds in both left and right hands. Okay, now we're gonna inspect. Let your arms on the side. We're inspecting for edema. Okay. Touch your too, see if there's any edema. Looks good. Thanks. So, no observed signs of edema, no upper or lower extremities. We'll palpate pulses now, so we'll start with the brachial. Radial. Okay, we're not going to check it here. We normally check femoral radial, so we're going to go to popliteal, back of the leg, knee, and there's posterior tibial down here. And on top of the foot is dorsalis pedis. So that's those. All pulses are +3, +2. And they're all symmetrical and bilateral throughout all extremities. I'm gonna feel your skin, the back of here. Okay. Okay, the upper and lower extremities are warm to the touch. Also forgot to do the DTRs thing earlier, so I'm gonna go and do those real quick. While we're here, the first one is your bicep. I'm just trying to relax your arm. So you're gonna hit the little groove just above the elbow. Hit that, and we get a response like that. Same on this side. Just relax it. Groove. Like that. Then we go brachial. Try to relax your arm. Hit your own finger. The other person, get the reaction there. Like this. Reaction there. Then also the ulnar. Just below the wrist. Reaction. Just below the wrist. Reaction. Now we do the knee jerk. Just go below the patella. And then we do on the back of the pedal, back top over the shoe ends. So this one. Yeah. Okay, and then next is Bushinski. Sponsors the patient's foot curling forward. Okay, so DTR and Bushinski's are intact in the patient. Okay, and so from here, we're gonna do the abdomen. So get up and go over there. Just lay down on the couch. Stethoscope. Good. Okay, so we would inspect the abdomen. Okay, so we're inspecting the abdomen. The patient abdomen is without any visible scars, no deformity, no bulges. No, it's concave. I'd say it's flat, not concave, actually. So no bruises, prominent venous patterns, or engorgements of veins around the umbilicus noted either. So now we're gonna auscultate. Okay. corrective bowel sounds across all 4 quadrants. And so now we're going to listen to the arteries. So we got the aortic, which is about 3 inches above the umbilicus. Okay, and then we'll go to renal, which is down a little and to the side.
Those are my arteries.
Yeah. And your ileus is just down a little more. Your iliac. I do not hear any bruits or abnormal sounds. Okay. Now we're gonna palpate. Okay, so palpate 4 quadrants. Flexing. Okay, do not palpate any areas of the abdomen which are tender or distended or have notice masses or palpations. Okay, and then now we're gonna oscultate or percuss. So just go over. Fingers. Listen.
Can you move my other
No. Okay. So note normal bowel intonations during percussion. And that's the end of the head to toe assessment.